Welcome to my YouTube channel. In this video, we are going to learn about disorders of thyroid gland. Disorders of thyroid gland means some disturbance in the structure and function of thyroid gland. That is, the anatomy and physiology of the thyroid gland is affected. First, we are going to see about congenital anomalies of thyroid gland. That is, defect in the development of thyroid gland. Ectopic thyroid, where the thyroid tissue may lie anywhere along the line of descent. That may be in the posterior part of the tongue or in the intrathoracic region too. Lingual thyroid, the thyroid tissue is present in the posterior one-third of the tongue at the foramen cecum due to incomplete migration of the thyroid gland. The lingual thyroid may cause dysphagia, that is difficulty in swallowing, pain and speech impairment, and also respiratory obstruction. Next is thyroglossal cyst, which is a swelling which occur in any part along the line of thyroglossal duct, and thyroglossal fistula, which is caused by burst opening of the thyroglossal cyst. We should also know about agenesis, where an entire lobe of the gland is not formed at all. Next is about hyperthyroidism, where there is overproduction of thyroid hormone from the gland. It may be primary or secondary hyperthyroidism. In primary hyperthyroidism, the pathology is present inside the gland, that is, intrinsic thyroid abnormality. And in secondary hyperthyroidism, the cause is present outside the gland. That may be a pituitary gland tumor or hypothalamic tumor where there is increased production of TSH or TRH, that is thyroid stimulating hormone or thyroid releasing hormone. Diagnosis of hyperthyroidism. In primary hyperthyroidism, T3 and T4 are high and TSH is low due to negative feedback mechanism. And in secondary hyperthyroidism, due to pituitary cause, the TSH is high along with high T3 and T4. There are some special states of hyperthyroidism. First, we are going to see about thyrotoxicosis, where there is hypermetabolic state due to effect of the excess hormone present in the body. Actually, the term hyperthyroidism and thyrotoxicosis are used interchangeably. But there is slight difference between both the terms hyperthyroidism and thyrotoxicosis. Hyperthyroidism means increased production of thyroid hormone, but thyrotoxicosis means the clinical effect of the increased hormone level present in the body. Next is about Graves' disease, which is named after a physician, Robert Graves. Graves' disease is the most common cause of hyperthyroidism, and it is an autoimmune disorder which is characterized by the production of autoantibodies TSI, that is thyroid stimulating immunoglobulin, against TSH receptors, and it is characterized by triad of thyrotoxicosis, ophthalmopathy, that is exophthalmus, and dermopathy. Graves' disease is also known as exophthalmic goiter. So, exophthalmus, that is protrusion of eyeballs, and goiter both are seen in Graves' disease. Next is about hypothyroidism, where there is underproduction of thyroid hormone by the thyroid gland. It may be primary or secondary hypothyroidism. In primary hypothyroidism, the cause is present inside the thyroid gland, that is intrinsic thyroid abnormality. The primary hypothyroidism can be congenital, autoimmune, or iatrogenic. Congenital hypothyroidism is most often the result of endemic iodine deficiency in the diet, or the gland may be reduced in size, that is thyroid hypoplasia, where there is decrease in the number of thyroid follicles, and autoimmune hypothyroidism, which is caused because of the autoantibodies production, and iatrogenic hypothyroidism, which is caused due to treatment taken by the patient either surgically or by radiations. And next is secondary hypothyroidism, where there is pituitary damage, which causes decrease in the TSH, or hypothalamic damage, which causes decrease in the TRH. In hypothyroidism, we are going to see cretinism and myxedema. Cretinism refers to hypothyroidism that develops in infancy or early childhood. The infants who are affected by cretinism are called cretins, and normally maternal T3 and T4 cross the placenta and it is required for the development of fetal brain till the fetal thyroid gland is developed. If there is maternal thyroid deficiency before the development of thyroid fetal gland, then the infant suffers cretinism. The clinical features are intellectual disability, short stature, protruding tongue, and umbilical hernia. In this picture, we can see the child suffers from cretinism, showing the symptoms of protruding tongue, umbilical hernia, and short stature. And in myxedema, it develops in older child or adult. The person suffering from myxedema is marked by decreased physical and mental activity. Diagnosis of hypothyroidism. In primary hypothyroidism, T3 and T4 levels are decreased, but TSH is increased due to lack of negative feedback mechanism. And in secondary hypothyroidism, the TSH concentration is less, and so there is decreased production of T3 and T4. Here are the signs and symptoms of hypothyroidism and hyperthyroidism. The symptoms that are common for both are hair loss, goiter, depression, and mood swing. The symptoms that are opposite to each other are reduced heart rate in hypothyroidism and heart palpitations in hyperthyroidism, cold intolerance in hypothyroidism, heat intolerance in hyperthyroidism, weight gain in hypothyroidism, weight loss in hyperthyroidism, constipation in hypothyroidism, diarrhea in hyperthyroidism, polymenorrhea in hypothyroidism, and amenorrhea in hyperthyroidism. Next is about thyroiditis, that is thyroid inflammation. There are some types of thyroiditis, and here we are going to see some. Hashimoto thyroiditis, which is an autoimmune disease that leads to destruction of thyroid gland and progressive thyroid failure. So, there is decrease in the production of thyroid hormone. The thyroid tissue is transformed into a lymphoid tissue in Hashimoto thyroiditis. Here, the lymphoid follicles are lined by epithelial cells with eosinophilic granular cytoplasm, and these cells are called Hürthle cells, which is an important characteristic of Hashimoto thyroiditis. And here are some less frequent types of thyroiditis like subacute lymphocytic thyroiditis, which is also known as painless thyroiditis or postpartum thyroiditis, and granulomatous thyroiditis, which is also known as dequervine thyroiditis, and another one is reduced thyroiditis, which is a rare type of thyroiditis and also known as fibroid thyroiditis. Next is goiter, which is the enlargement of thyroid gland. Here are some gradings given to the goiter for diagnosis. Grade 0, where there is no goiter present, and grade 1, which is a palpable goiter but it is not visible when the neck is held in normal position. And grade 2, a clearly swollen neck, which is also visible when the neck is held in normal position. Goiter can be broadly classified as diffuse non-toxic goiter and multinodular goiter. First, let's see about diffuse non-toxic goiter, which is also known as simple goiter. Here, the gland is enlarged with no nodularity, and the gland weight does not exceed more than 100 grams. It occurs both in endemic and sporadic distribution. Therefore, the subtypes are endemic goiter and sporadic goiter. Sometimes the goiter can also be caused by the goitrogens. What are goitrogens? The substance that disrupt the production of thyroid hormone by interfering with iodine uptake in thyroid gland is called goitrogens. For example, cassava root, Brassicaceae family such as cabbage and cauliflower. Next is multinodular goiter. Here the gland is irregularly enlarged and the weight of the gland exceeds more than 2000 gram. The goiter even may grow behind the sternum and cause retrosternal goiter and may even compress the larger blood vessels like superior vena cava and may cause superior vena cava syndrome. Next is clinical examination of thyroid gland. Here are some clinical tests that a doctor will perform to know whether we have any thyroid abnormalities. And here are some methods that are classical method, Kreil's method, Fisler's method and Lahey's method. And next is Pemberton's sign, which is an interesting thing. The patient is asked to raise both the arm above the head until they touch the ears, and the patient is asked to hold this position for a while, that is for 2 to 3 minutes, and in case of retrosternal goiter with the engorged veins, there occurs congestion of face and distress. So, if the Pemberton sign is positive, there is congestion of face and distress. Here are some medications that are prescribed during thyroid abnormalities. And in hyperthyroidism, antithyroid drugs are used such as thionamides, propranolol, which is a beta blocker, anions like perchlorate and chlorate, then L-thyroxine, that is levothyroxine, which is usually taken to treat hypothyroidism. A surgical method called thyroidectomy is usually done for the patients with thyrotoxicosis and to treat benign and malignant thyroid tumors and also to relieve pressure symptoms such as respiratory distress that causes dyspnea and dysphagia, which is difficulty in swallowing. Here are some types of thyroidectomy like hemithyroidectomy, subtotal thyroidectomy, partial thyroidectomy, near total thyroidectomy, and total thyroidectomy. In hemithyroidectomy, the entire one lobe along with the isthmus is removed. Do you know why the isthmus is removed? Isthmus lobar junction is more prone to nodularity. So the isthmus is removed along with one entire lobe in hemithyroidectomy. In subtotal thyroidectomy, 2 grams of the tissue or the size of pulp of the finger is retained and the rest is removed. And in partial thyroidectomy, the tissue present in the tracheoesophageal groove is left and the remaining is removed. In this picture, we can see that the yellow portion, that is the tissue in tracheoesophageal groove, is left and the rest is going to be removed. And in near total thyroidectomy, less than 2 grams of the tissue is left and the rest is removed. In total thyroidectomy, the entire thyroid gland is removed. Here is a special type of thyroidectomy, heart seat and pill operation. The part removed here is isthmus, one entire lobe, and on the other side, partial or subtotal thyroidectomy is done. And the tissue present in the tracheoesophageal groove on the one side is retained. Like, share and comment my video. Do not forget to subscribe my YouTube channel. Thank you for watching.